first question to you is can you briefly tell about surgical residency in India?
Yes, definitely. Okay. So this thought itself amazing. Okay. Surgery residency, that too in India itself is amazing. That decision you have to take, that nobody can decide it for you or convince you. No, not possible. That should come by within. Okay. So you would have already worked in internship in various branches. Okay. So by now, which branch really suits you, which is apt for your personality, etc. You would have already decided. So at least you should have a broad categorization, like you want to go into medical branch or surgical branch. Even that much should be there. So after some discussion with your seniors, parents, mentors, etc., then you will finally conclude that you want to take up surgery as a career branch. And it's a broad specialty. There is no harm taking it in any way. Okay. Even by mistake also, if you take, you will not regret for sure, because surgery is such a broad specialty, after which you have a lot of options depending on your career chance, opportunities, and your personal preferences, etc. So just get an MS general surgery degree, after which you can decide with what you want to go further. So that you decide want to take up the general surgery, and then we have a lot of options after deciding it. So first thing is you should conceive an idea. Yes, I want to be a surgeon. That day, the day you made up that decision, you are a surgeon. Believe me, you are a surgeon from that day one. That idea you have conceived. So only then you have to do is believe firmly in that. Okay, yes, I'm going to be a good surgeon. I'm going to be a successful surgeon. That should be your goal, and finally you definitely will achieve it. So that's about surgical residency in India. And if Kishan has done, means anyone can do that. Okay, as simple as that, Dr. Priya.
Yes. So moving on to the next question, which is, I think, what everybody has a doubt about: how to choose colleges.
Yeah.
With a lot of criteria, which is a lot of doubts people come up with. Yeah.
So what are the criteria you have?
First one, government versus private.
As an aspirant, you will be looking for, you already making a search of good colleges. So what are your criteria in mind?
So government college or private college is the first question.
So which one you would prefer?
Well, based on what everyone says, government. But yes, what do you say?
So see, again, government is preferred or private colleges definitely. Main thing, two factors. First thing is the patient factor, patient load. Second is, of course, the fees. Okay, fees wise also. But having said that, there is nothing like specific, which is better, this is better, this is not. Okay, I'll tell the secret at the end. Okay, after all your criteria put together, I'll tell the secret, which is better or which is not. So if you ask me which is better, definitely I'll go with the government college.
Government, okay. So then peripheral college, government, or in the cities?
Okay, again, cities, metropolitan cities, colleges are good, but it's so hectic and toxic. Okay, in those like in Mumbai, Kolkata, these are hubs for surgery, agreed, but it's very much toxic. So peripheries are preferred. Peripheries are preferred where the number of PGs will be less in those colleges. So and all variety of cases you will get, and less of super specialty will be there. So in general surgery itself, you will get to see or operate or all those super specialty cases as well. And in all those aspects put together, peripheral colleges are better for surgery.
Okay, so this little doubt on super specialty part. I mean, is it better to have a college with super specialty where PGs would get posted there, rotating there, and therefore get the exposure, or college with less number of specialties so that the cases would come to general surgery?
Nothing like that. Okay, both ways. See, it's again depending on the college setup. Even though if you have all super specialists, that's well and good. You'll be posted there, and you'll be like assisting there. That's good actually, because you'll be learning in a proper way. Okay, from a super specialist, that's good. If you don't have, also doesn't mean that you will only get to operate everything in general surgery. Many times you may have to refer it to higher center or other. So that's what used to happen in my Bangalore Medical College. Okay, where I did my undergraduation during internship, all the cases, in any neuro cases, it will refer to NIMANS. If any cardiac cases, it will refer to Jayadeva. So at the end, nothing remains for you. Okay, so there is nothing like that college specific. In both way, either way, it's good. Either way, it's good.
Okay. So then another important part, central institutions versus the state colleges.
Very good. For MS, it's definitely state colleges. No doubt about that. Okay, for MCH, central institutes are definitely good. But for MS, note it down, it's always state colleges.
So what makes the difference, sir, between doing it in the central?
Yes. See, in the sense, in the central institutes, all are referral centers. So you will get only complicated and only very complicated and complex cases there. Okay, so residents themselves may not get to touch anything. Only you will be doing a lot of clerical works and assistant job. Okay, so you should get minimum, at least minimum amount of surgery chances as well. So that is which is meager in central institutes. Even in 3 years, you may get, see, in central institutes everything is protocol based. I was there at AIMS. So everything is next, even as Sri Chitra also, it's again a central institute. So everything is protocol based. Residents will have a logbook. You will carry a logbook. So they have like, okay, in this type posting, you should be made to do one hernia surgery. So under the supervision, see, advantage there is you'll be doing everything under supervision. One guide will teach you from skin to skin. Okay, so you'll be doing minimum number of surgeries, 1 or 2 or 3, one appendectomy, one hernia. If you get more than that, it's a bonus for you. But you will learn under proper supervision and proper methods. Okay, but surgery, yeah, definitely you need a good methods and supervision, but you need more confidence. More confidence you gain by doing a lot of cases. Okay, so in that aspect, state colleges are preferred. Although there is the lack of protocols and lack of supervision are there, but you are matured enough at that level, MS level, you are matured enough than the UG level to understand which is good, which is not, which is a better way. All those things you can understand for yourself and implement. So state colleges are preferred for MS. For MCH, of course, the central institutes.
Okay. And so the last part of this question is DNB, MS versus DNB. What is
okay? Given a chance, MS is nowadays there's not much difference between this MS and DNB. Both go hand in hand. But even then, for at least to show off, its MS is preferred over DNB. But again, having said that, if you have plans of doing MCH further, DNB is also more than enough. Okay, you can do a DNB MS surgery and then go for a super specialty in a good institute. Okay, but if you are confining yourself for just a general surgery, then I would prefer MS over DNB. Okay, but having said that, there is nothing except for the degree value. Okay, rest all the training and the amount you learn, amount of surgery training, everything will be more or less it's equal. In fact, in many DNB centers are much better than the MS colleges also. I'll tell you why at the end. Okay, many private. Yeah, you ask no private or government. You ask no. Yeah, many times what happens is private college is just like a blessing in disguise. Okay, so what happens in government colleges, for example, in government colleges you get 10 appendicitis cases, and private you get 2 appendicitis cases. Okay, in government so much it's patient loaded and all, you will not get to do anything properly. It will be just like mechanically or like a butchery. You'll be doing everything just to finish. Your only aim is to finish up the case and go home there. But in private, you have only 2 cases. Okay, so you have all the time to properly work up the case and properly slowly do the in a government hospital per day there will be 5, 6, 7 cases. So only thing is to finish up the that OT list in that day. So many a times seniors or the consultants themselves do it off and they go away. Okay, and residents end up just doing the post-op monitoring. That's what happens. Okay, but in private it's not like that. Only 1 or 2 cases may be posted per day, so you have all the time to do an appendectomy for 2-3 hours. You have that leverage. Okay, so you can do everything step by step, and you can learn better, I feel. See, as an intern, I was doing internship in Victoria. I used to do some 20-25 ECGs per day, but there is not even a single minute to just go through the ECG what I have done and what to interpret that, because there is next 2-3 patients are waiting there. I'll be just like a technician. I'll be just keep on doing ECGs and giving that ECG this thing to my PGs. There is no time to study or learn or interpret that ECG. It's not possible. Whereas in private, you have all those ample amount of time to do proper study and proper training there. So don't worry. At the end of the day, what I want to say is, it's private or government, DNB or MS, central or instate, all those things doesn't really matter at all, Priya. Okay, please mark my words. Okay, at the end of the surgery residency, what really matters is how good you are. How good you are. Okay, how good you are with the patients and by yourself.
Right.
Understood. So what the really required in residency is to build a good trust or relationship with your consultant and colleagues. If you tell me, Priya, you are my resident, you are my second year resident. I am a consultant, okay, head of the unit, and there is appendicitis case has come, which is a very simple case. Why I should give it to you to operate?
First, you should trust me for that, and I should be.
Why? There is no other reason at all. There is no other reason at all. Only one reason with which I can give it to is the trust. The belief. Yes, if I give to Priya, she will do the justice. She will do the justice the patient as well as my decision. Correct. She will do much better than me. So only that trust. So how that trust will come?
Based on my hard work and how I'm doing it.
Absolutely. So your hard work level is different in private college and your hard work level in different in government college, or it's different in the central institute and different in peripheral college, or different if you're doing put more efforts if you're doing MS, or if you're putting less efforts you are doing DNB. No, nothing. So everything is personal here. Means how good you are. If you are sincere enough, if you're hardworking and acquire that your consultants trust, if you build up that trust, then no looking back for you. Anywhere you are, which your institute, which your city, which your college, which your branch you are, you will succeed. So what's this? Most of the students doesn't understand this. Okay, they expect that yes, I'm in best college and I'm the best rank holder and I should get all the chances. I should get to do all the surgeries. Because I'm a PG student, I'm a trainee. No, that's not the way. See, you do a surgery, appendectomy, and something goes wrong. You do the suturing, skin suturing, and there is a skin infection tomorrow. Who is responsible? I'm the consultant. As a consultant, I'm the responsible. In PG, no way is responsible. Okay, nobody can say Priya did, so ask her. I can't say that. As a unit head, I should take the responsibility. Any blame or anything, because I may be sued or my career may end just by giving you one chance. Understood?
Yes.
So that time I can't substantiate that, she is my trainee, I should give her chances, so this happened. No, I can't tell that in any way, in any court. So if I get you show your sincerity and you show that you are caring for your patients, then definitely, even I don't want to do, even after so many years of my surgical experience, I don't want to do appendectomy, hernia, all those things. I am more than happy to give chances, provided you should show your sincerity and hard working from your side. Agreed? So finally, you consider if you have a very good rank, if you're getting, you consider all these criteria, which college, where and all. But finally, all these things doesn't matter at all. Okay, I was there in AIMS. There is no trend of giving it to residents at all, the surgery, but I had got within 3 months. Within 3 months, I had got to operate a ASD case independently. How? There's no trend at all in AIMS to giving it to residents. In Sri Chitra, I had got a lot of chances to operate independently. How? When my seniors were not getting, I had got. Why? Understood? That's simple. So there is nothing like trend. You need not ask how is the cutting chances there, how is the this thing. No, doesn't really matter. Okay, others not got doesn't mean that you should not get. If you're really good, definitely any consultants will give you the chances. Understood? So please, you be sincere to yourself. No need to please others. No need to impress others. Okay, even there's a saying in surgery. Okay, even the surgery wards have got ears and eyes.
Right.
Okay, it's not that just what you do in front of the consultants that really matter. Even when they're not there, how do you work? How you take care of the patients? how you do the pre-op workup, everything matters, because even the group D workers, nurses, everyone go and tell feedback to your consultants. So they will come to know somehow what you're doing, how you're doing, how you're bluffing them, when you're escaping, what time you come to the ward, what time you go, everything they'll come to know. Okay, so on that basis only, you'll get all the chances, priorities, everything. Clear?
Yes, sir. So then moving on to the next question, just the last part of it is that 6 years courses, sir, whether it's DNB or integrated courses with MCH, what is your opinion on that?
So your question is whether 3 years MS and then 3 years of MCH or 6 years of integrated MCH? No?
Courses. How is it a wise decision to take?
No, not at all. Okay. See, at the end of the UG, you will have not much idea about the surgery, in the sense you have worked for only 1 or 2 months in internship. That gives an idea of for taking up surgery. That's fine, but you'll not have an idea about the super specialty branches like neurosurgery, plastic surgery, so many things, gastrosurgery, so many things are there. That idea you'll get only when you attend those postings in your MS. Okay, so in MS, in the second year, you'll be posted in all super specialties like urology, plastic, everywhere. So then you can decide, which is good for me, which branch is suitable, which is I can manage. All those things, that idea you'll get only during your peripheral posting during your MS or DNB second year or third year.
Yeah.
So without which, if you directly take up from outside, everything looks fascinating. Oh, neurosurgery, my God, so nice. CTVS, cardiac surgery, my God, excellent. Okay, looks so good. But if you suddenly go there after MBBS, you don't have any idea what is surgery, you don't have any practical knowledge of surgery. You don't know how to put an incision also, how to do suturing also. So if you suddenly go there, you'll be lost. You'll be lost in the ocean. Okay. And then you should not repent after joining. Oh my God, I can't neurosurgery. I have to stand for 5-6 hours, which I can't do. I don't have enough stamina. All those things you can't do, blame games there. Okay. So better do MS for 3 years and have a fair idea of all the super specialty or subspecialty branches, and then decide for yourself which is better, and then you can go ahead with whatever you decide. Okay, so always it's better. The only criteria is from the childhood you have a dream that you want to be a neurosurgeon at any cost. Okay, my father is a neurosurgeon, I want to become a neurosurgeon. If you have such fantasies or dreams like that, then you can, wise decision is to go with directly that 5 years neurosurgery, this thing is there, or 6 years surgery, because unnecessarily it doesn't matter if you want to become a neurosurgeon, how many appendectomies you are done or how many thyroid surgeries you are done doesn't make any difference. Okay, so because it's purely different, you do not touch even a single brain surgery during your MS. Suddenly you start your MCH from zero. Understood? So if you're purely, there are two super specialties purely, that is neuro and cardiac surgery. So if you have a dream of taking those two, then definitely you may take up directly that 6-year course. But even I suggest no. If you ask me, I suggest no, because you should have a basic general surgery idea, whatever you may be. Okay, whatever super specialist you may become, but you should have a basic general surgery idea. You should know how to give respect to the tissue and how to achieve hemostasis. All those things you learn only during general surgery this thing. Okay, so better to go that proper protocol after general surgery, do the MCH. Okay, even in 6-year integrated course, you will have 1 year of general surgery posting. Agreed, but even then that's not sufficient to learn all the aspects of general surgery. So better to go by, because many nowadays, now you may in a childhood or during UG you may think that neurosurgery is the best, but after going there, after having practical experience for 1 month there, you may realize, oh, I'm not fit for this, or this is so difficult for me. You may realize. So then you have all the options to change to some other branches. But if you've directly taken up that branch and you already started, then you can't, very difficult to come back. Okay, so in all that aspect, MS and then MCH is better.
Okay, sir. So the other thing was, so surgical residency is considered to be one of the most hectic residencies, those 3 years. Mm-hmm. So how is it? So what advice would you give on the preparedness strategy? There's so many things that happen. I mean, there's OTs, there's rounds, there's OPDs, there's thesis, there's the studying part of it. So how does one handle everything?
How others have handled? Yeah, you are not the first resident to do general surgery, right? Am I right? There are thousands of students have already done that and they become surgeons and they're doing well. correct? So if all of them have done means you can also do. As simple as that. Need not break your head what exclusively. Okay. So but you should have you should have a strategy and preparedness so that you can do much better than others. Strategies, yes, whichever college you get, if you want surgery, take up surgery in any college, wherever you get, just take up. Okay, don't again wait for another year or so. Just take up wherever you get. And if your strategy preparedness is good, definitely you'll do well, irrespective of your college or branch or whatever. So first year, the strategy should be to learn all the practical aspects. Don't worry about opening your book at all for 1 year. Okay, I'm not able to study, I'm not able to read that book. No, don't have any such thoughts at all. First year should be dedicated for all learning the practical aspects. Like, first thing you should know in first year residencies, clinical examination of each case. Hardly surgery, some 7-8 types of cases are there. Okay, this thyroid, breast, and mass per abdomen, hernia, hydrocele, and varicose veins. Okay, some 7-8 hardly cases are there. So you should know well how to do proper examination and differentiate all those things. Clinical. Okay, so clinical proforma along with proper clinical examination, all the varicose vein test, all the thyroid test, everything you should know. There is no excuse for that. Second thing is all the pre-op preparations. Tomorrow there is a C rectum case is there, how to prepare. Tomorrow there is a obstructive jaundice case is posted for surgery, how to prepare or work up that case. What are the investigation? What are the pre-operative things you should do? Okay, all those things. What are the possible complications you should anticipate? All those things you should know. Third thing is definitely the operative steps. Operative steps. You should you may be going to OT tomorrow, so you should know the steps. Only then you can follow what's happening on the OT. Or simply you'll be standing, they'll be doing something. You can see some bloodshed there. That's it. Okay, but if you're really seen the steps or seen the videos and go to the OT, then you will really understand what they're doing, how they're doing. Okay, or the steps you'll understand better. So 3 things you must know in the first year residencies. Is all the clinical examination of every case in surgery. Second thing is all the pre-operative aspects. Okay, how to prepare a case for surgery and all. Third thing is all the operative steps. Okay, there are good books, so many good books available. I'll try to put it in the comment section in the YouTube. Okay, and third thing, some surgical skills like suturing you must know. Suturing, all variety of suturing and knots you must know. Okay, if you don't know, there is no excuse for you. Okay, so learn all these things. You will not learn in 1 day or 1 month. So you have to practice it, because these are all the arts. You can master it over a period of time. So you have to practice whenever you get an opportunity. Suturing skills, knotting skills, and dressing. Variety of dressings are there. Variety of dressing. Okay, so all those dressing things you should know. These are the basic skills which you'll acquire during first year residency. So you should be well prepared for that. Read the appropriate books and videos, whatever available, resources available. Second thing is thesis. In the first year, in the beginning only, you should select your guide and the topic for your thesis. See, my recommendation would be select it. Don't go to do a very big thesis or very big research. You think that I'm a scientist, I'm going to do big research. No. In your surgery residency, keep the thesis as simple as possible. It's not in no way it's going to matter much in the future. Okay, so select a very simple observational study. Okay, no randomized control study, all those things. Simple observational study. And what all you things to look for is feasibility. Okay, in your hospital, if I take up this case, whether it's possible to do, because so many patients are there or not. My one of my friend had taken what is that one neurosurgery, one shano, something, one rare case he had taken up. Okay, in the entire 3 years he had got a single case. So what is the point in doing such a thesis? Okay, so first thing is see the feasibility. What is the most common cases you get in your hospital? Maybe cholecystitis or pancreatitis. So try to do some top thesis on such topics only. So common topics. Okay, so that will be very convenient for you. Need not break your head for thesis at all at the end. Okay, so select easy topics, that thesis. And study, I already told, first year, don't break your head first about studies. If you get time, well and good, read Bailey and other like organ specific books are there. Okay, main got and other things. So you can read that. And second year, you will be posted in super specialty, and that's the time where you can decide what super specialty you want to do, and you can start preparation from second year onwards. Okay, and third year will be definitely you'll be very much concentrated about your exams and thesis completion and all those things. So you'll be again very much occupied in the third year. So this is how you should go about in your 3 years of residency.
And so, how do you handle all the stress? I mean, you having done it in a government college, you were very active there, and you were very active on White Army, making sure discussions were happening. So, how did you manage everything?
It's all about your preferences. It's all about preferences. Okay, how you prioritize things. So there's nothing called see, stress you get only if you don't like something. Okay, I feel okay. If you really like, then it will not be stressful at all. How much your work you have, how much your patients, whatever is there, you don't feel it's. You'll definitely enjoy. If you really love it, if you really love surgery, you'll definitely enjoy doing it. You'll never feel stressful. Only when you doing only clerical work, you're not getting any opportunities to surgery or going to OT, then you feel like no, it's so not interesting, and then you may feel it as stressful. Okay, and see, there is no alternative but for hard work. This is like foundation or investment. These 3 years, if you work hard, if you slog around, and if you learn all the basic aspects, it's not the surgery. It's not just doing surgery. Okay, as a surgeon, as a team leader or captain, you should know all the aspects. On the nursing aspects also, you should know. If they're not doing well, you should be able to tell them. So no, not keep the mop count, keep that this everything, out of the instruments, how to clean them, everything you should know. Some laparoscopic instrument they may not know how to handle, you should know. Okay, even the OT technician's job, how to adjust the light, how to adjust the cautery, this thing, everything. Their work, their job, but if they're not doing, it will affect your surgery, right? Your performance. So of course you are expected to know all those things also, and how to sterilize a OT. So, and even in the government, I remember in first year, I only used to push the patient in the trolley, and I only used to do all the shaving, part preparation and all. And because if you leave it to them, they will take 1 day to do all those things. It's for you who is required to do all surgery now. So you have to prepare, you have to push the I'm a surgeon, I will do only surgery. If you are so like adamant, then at the end you will not learn anything. And you should go to the pathologist in first year. You should go to the pathologist by yourself. You should go discuss with them. See, madam, your FNAC's report like this, and the intraoperative is like this. And or go to the radiologist and tell. See, you had given in the USG, it's this thing appendicitis. When you opened, it was appendicular mass. Or you had marked on Doppler, you had marked all the incompetent perforators, and it was perfect. We had a very good time operating on that patient because of your markings. Thank you. So a surgeon and radiologist and pathologist should have a very good coordinated relationship and coordination for the success of any surgery. So I would say all your success of residency depends on only one criteria. That is how good you build up the contacts or relationships from the day one. So initially there will be stress. Okay, agreed. Why? Because it's a new place, new people, and everything is new. So to adapt yourself will take little time. So then see, to do a 1-minute job, you will take 5 minutes. So at the end of the day, you will not be able to complete whatever the work is assigned to you, because for everything you have to search things, you have to think twice, or it will take time to grasp. Okay, but sooner or later, once you start grasping the things, okay, it will not take much time for you. So you'll try to finish off very soon. To make, and more than everything, you should do smart work. How to do smart work in residencies? By having good contacts. Okay, what I used to do is, see, suddenly at 11 o'clock, consultant would call me. Who is that patient? Any resident, I was sleeping in the post duty. I'm sleeping in my hostel. Any resident would have ran to see that patient, and then again check for heart rate, and then call back the resident, call back the consultant. Whereas I had very good contacts in the post-op ward. All the numbers I had, all of their sisters, brothers, technicians, everyone's numbers, and they are very securities. Everyone's number I had in my phone, and they were in good terms with me. So one just call, sir, only 1 minute, sir. I'll immediately call that brother who are posted in the ICU. Brother, how is the like heart rate? You'll tell, sir, it's good, sir, 80, 82. Okay, then immediately. So that's the smart work. Instead of running here, then there, haphazardly and going all around, wasting your energy like for all the physical work, you can do this kind of smart work as well. That you can do only when you have good relationship with all the departments, all the other staff, your colleagues. Okay, so then you half of your physical fatigue can be reduced by doing smart work. So even stress also will reduce because you get ample time to do to finish off all your work. So, okay, this is very important. From the day one, have no ego or have no audacity. You only wish, as soon as you enter the hospital, you only wish the security guard, good morning, bhaiya, kaise ho didi. Okay, group D also, they are also required. If they don't come for one day, you can't step in the next day in the hospital. So don't think that only doctors are necessary, important for the hospital. Group D, security. If security is not there, you can't work peacefully in the casualty. Okay, you are always afraid that when the patient party will come and beat you. So you can't work peacefully. So as important as the doctor, security guards are also important. Okay, so give them good respect. They will also. My day starts with wishing the securities in the parking. Okay, I only wish them in the morning. Security guards in the parking, good morning, bhaiya. So I get special preference for parking and all. Then okay, 2-3 days you wish, fourth day you'll get special preferences for parking. So all your work. See, what I mean to say is, it's not influencing. You're making your work easier. Okay, you give them a little bit of love or respect to others, and automatically your work or that burden keeps on easy. Okay, so and you have good relationship with the other branches also. So all your work, you need one fitness. So on one call, please come and see this patient. I need a quick fitness for emergency surgery. If you don't have a relationship, you have to go around them, plead them, beg them. So that takes a lot of efforts and time also. So see, so secret behind your successful residency is, Priya?
So building very good contacts with people.
Perfect.
Respecting everybody.
Perfect.
Thanks. So then moving on to the next question, how did you train yourself to become like a really successful surgeon?
Yeah. So a surgeon, one thing is that you should have that belief. Okay, yes, I'm going to be the best surgeon possible. I'll do my best. Okay. So one sees and success is a very subjective reference, right? So for someone, something could be successful. For someone else, that may not be the success. So I feel, according to me, in the patient's eyes, if you are seen as a good doctor or a very caring doctor, that's a real success, because it's very difficult to be considered as a good doctor nowadays. Okay, your small mistake also, people will pull your legs and they will blame you for everything, and it's very easy to become a bad doctor. But to become a good doctor, successful doctor, it's very, very, very difficult. Okay, you have to struggle a lot. But it's possible by doing only one thing. Or everything, all our thought process or all our work actions, everything should be patient-centric. So that's possible by having one virtue, important virtue, which every doctor must possess. That is empathy. Okay, what is empathy? It's not sympathy. Sympathy is different. Anyone can have show sympathy, but empathy is difficult. Empathy means seeing ourselves or our beloved ones in that patient's position. What if my own brother was there in that appendicitis patient's position? What I would have done? Okay, what if my father was suffering the same? How would I have treated that patient? Understood? No. If you have such thoughts, then you will try to do your best. Okay, you will, and there will be so tight, strong, firm bond between you and patient. Whatever you do, you sometimes commit some mistakes also, they will forgive you, and they'll be okay. They'll say, oh, doctor tried his best, but still it's our bad luck. They'll consider. Okay, so if your efforts are pure and if patient centric, okay, then definitely patients will consider you as next to God, and next everything they will take care. You just give proper care to them, okay, by good communication with them, okay, and communicating what are happening in the patient and patient attenders. Second things, good care, or operative care or pre-operative, post-operative, whatever it is. Try to do your best to the patients. The rest everything will be taken care by them. Okay, they will bring you by that. See, that's what in surgery you might have seen very less surgeons doing any promotional activities or some marketing this business and all, because in surgery it doesn't really happen. Okay, that way. In the surgeons, we get patients only by word of mouth. My patient who am done hernia, he got benefited and he will bring me 4 more patients. That's how it works, not by any marketing strategies. Okay, so if you're good with one patient, definitely he will get you 5 more patients, and that's how you become do more cases, more number of cases, and more successful, and you be the best surgeon. Okay, so initial days, especially start from residency itself. This is a surgeon is a personality, it's not a profession. Okay, so that personality you can get over with one degree. Third, at the end of the third year, you'll get a degree and you suddenly become surgeon and suddenly everything changes. No, it's not like that. I told you, the moment or the day you got that idea that I want to become a surgeon, that day itself, you are a surgeon. Okay, from then, day one only, you should start transforming yourself, or the personality should change appropriately and adequately. Okay, all the surgery is all about decision making. Okay, see, knowledge everyone will have. There's no dearth of knowledge for anyone. Okay, what really matters is decision making. See, there is one case now, appendicitis, whether to operate or not. That is different for different cases. All appendicitis cases are not to be operated. Okay, not to be operated. That decision taking skills will come with slowly with experience and wiseness. Okay, all those things you'll get used for the decision making. That you should start doing from the day one of your residency only. See, now in the morning rounds, you do first round, the residence round. Then you give your decisions for each patient. If I am the consultant, what I will do for this patient. Okay, whether I'll operate or whether I'll get a CT scan or whether I'll get what I'll do. You make a decision for yourself and keep it in your mind. When the consultant comes, if he asks you, then you can tell the same. You are already prepared with your answer. Then no thinking what to do. And now you can ascertain yourself what my decision was correct or not. See, my decision and consultant decision both are matching. That means I'm going in the right manner. Understood? That decision making you have to learn, and that sincerity. See, that honesty. That all those things should come by within. Surgery is posted at 12 and you should be there at 12. There is no excuse that you will come at 1 o'clock and say, let's start surgery. No, nobody will wait for you. And you are the team leader and you should set example for others as well. So all these things, punctuality, honesty, all those things, theoretically great virtues, but it's good to have in real practice also. Okay, so all those things you should learn and do during your residency. So automatically, you will do it when you are consultant also. So that's how you become a successful or the best surgeon.
Yes, sir. That was quite enlightening, sir. So one more question is, it's the general talk that surgery is getting saturated. So like, what is the way ahead, sir, for post-surgery? Like, what is the way ahead in terms of super specialization or continuing in surgery?
Correct.
And one more question I wanted to add here, sir, is academics in surgery. Like after finishing surgery, how is it to join a medical college and then continue?
Okay. So see, residency is it's not a spoon feeding. Okay. So unlike undergraduate teaching, in post graduation, nobody will teach you like from page 1 to page 100. There is no proper curriculum or say syllabus. You have to learn case wise. So today there is one CA breast case is there. So I'll read all about CA breast and go prepared for the grand rounds tomorrow. And I'll manage the entire from the admissions to discharge. What all happened? How did we work up? How did we operate? What is the post-op care? That's how you learn. Okay, in the residency. And of course, there will be some seminars, journal clubs, all those things. And so 3 years, you will have all this more of practical learning. And at the end, you will simultaneously study also from the books. That's how makes it a perfect residency. Understood? So it's not like undergraduation, you will read from page 1 to page 100 and you cover up everything and you give an exam. No, it's not possible. And you are evaluated not just based on your exam performance. Okay, in the residency, in the UG level, okay, everything depends on your final exams. But here in residency, no. You are assessed by your 3 years performance and progress. Even on the exam day, if you're not performed well, even then they'll consider to pass you or do make you topper based on your all previous 3 years performance. If you're really good, you're doing well, answering well during the rounds, everything, they'll consider you. So postgraduate degrees always it's given, not taken. Understood? Huh? So in 3 years, don't think that everything I'll do at the end. Exam mein dekha jayega, मैं देख लूंगा उस time. अभी तो क्या है पढ़ना है, मैं last में देख लूंगा. No, it's not that way. From the day one, your impression, the like what say, consultant impression should be good. You should try to build a very good confidence and trust with the consultant. Okay. So, and what do you ask? Question?
Sorry, sir.
Question? What did you ask?
Super specialization. So
super specialization. See again now. Once you've done all those things, you pass. Then you're left with 3 options. One, you are settled with the settle as general surgeon and practice either in a private practice or join any medical college for teaching along with practice. That's a good option. That's a very good option. And this second option is doing super speciality. Okay, either during a residency only prepare well and immediately get a super specialty branch of your choice and do that. Or you prepare for you practice for 1-2 years. Okay, then you have a fair idea which branch you like and then take up. That's also a good idea. Okay, so there's no hurry. There is no hurry at all. You take your own time, because at the end of the day, what really matters is Dr. Priya was a best gastroenterologist for 38 years and 32 years. Does it make any difference?
No.
What really matters is Priya was a very good or best gastroenterologist or best plastic surgeon. That's all really matters. The last word, what I told, for 32 years and 38 years, it doesn't really make any sense. Correct? So you may drop 1 more year or 2 more years to take up surgery seat, MS seat. If you really like MS, general surgery, you drop 1 more year. Don't settle for any other branches just because you're not got a less rank. Doesn't make that unfit for a surgeon to become a surgeon. So don't take up some other branches just because you got a low rank. No, that's not the criteria at all. Try for another year and 2 more years. That's fine. Ultimately, what? You are a surgeon. Okay, that's what 32 years, 28 years, 22 years doesn't really make any difference. You wanted to be a surgeon and you are a surgeon. That's it. Okay, even for a super specialty also, immediately you need not take up. If you 1 year, 2 years you don't get or you don't take, it doesn't mean that you are a failure. You're not fit or you're not capable. You're taking time to assess yourself, your which is best and okay, what to do next. You're taking time, and this is a wise decision also. To work for some time. See, before taking up cardiac surgery, I worked in one hospital for 1 year to really know whether it suits me or not. After I was doubly sure that yes, this is going to be my future, then only I took. I was getting, if I write the immediately next also, I was getting a seat, not an issue. But I took 1 year to work and then doubly sure before taking up, because rest of the life you're doing the same thing, cardiac surgery for 30-40 years. So here, if you take 2-3 months or 2-3 years here and there, then doesn't really make any difference. You understood? So take your time, even for taking surgery or taking super specialty also. Take your time and make proper decision. Once you made your decision, then no second thought should come. Okay. So that is the second is super special. Third thing is, nowadays there are some fellowships also available. Fellowships like 6 months, 1 year fellowships. Although it's not recognized by MCA, but available. Okay, so you can do that and you can settle with that also. And all this depends on where you are going to settle down. Like in metropolitan cities, like you already said, it's already saturated. Even the super specialists also saturated. But there's not a criteria for not doing it. See, I already told you, there may be 10 gastroenterologists in your, where you live, where you live, Priya?
Ramanagar, sir. Yeah, close by.
Sorry?
CV Ramanagar, close by.
CV Ramanagar, there is 10 urologists, and you are the 11th one. Who knows? You may get all the 100 patients and they may get 10 patients. Okay, saturated doesn't mean that you'll not get in any cases or you'll not get anything. You understand? If you are good, if you're better than them, definitely you will get all the patients. I told you, ultimately what, even for practice also, what really matters is See, I have settled in Mangalore for it's 1 year now, and in first year only I have done more than 250 major cases independently. Who will get so many cases in first year?
Yes, sir.
Okay, so it's totally on you how good you are. Okay, how nicely you take care of the patients. So there is nothing called saturated over the no, nothing like that. If you are good, definitely patient will come in search of you. Third thing, yes, the future would be, my dear junior colleagues, what I suggest is the future would be there's nothing called super specialty or subspecialty in future. The future would be after 10 years down the line or 15 years down the line, the situation will come wherein you'll be a surgery based surgeon. Already it's there. Even after doing gastro GI surgery also, then they again fellowships like only liver transplant surgery, only hepatobiliary surgery, only what is that pancreatic surgeon. Okay, even after doing urology, you have some fellowships like only renal transplant, only renal stone, on this. So in already there are surgeons who is doing only MRM, only mastectomy, only fistula surgery. They are doing really well. You don't think that if I'm doing only one case, I may not get any case. No, that's absolutely wrong. If you are doing only one case and then you'll get more cases because you'll be well versed in that, and all other general surgeons also will refer that complex fistula cases to you only, thinking that why should I simply take any risk? He's anyway doing that only. He's specialist in that. Let him take all the burden. Means okay, they'll send all the fistula cases to you only. So you'll be doing 20, 30 fistulas per day per week. Okay, that's the future. You'll be doing only one surgery. Now there are surgeons in Calcutta whom I know. He does only lap cholecystectomy, only one surgery per day. 20 lap cholecyst does, and he takes maximum 7 minutes for one surgery. One skin to skin laparoscopic cholecystectomy, he takes 7 minutes. It's not the speed that really matters, but I'm telling you, he's become so expert and specialist in that particular surgery. That will be the future. So don't worry much about the super specialty, which I going to take, which will have scope and all. Okay, when you finish off the general surgery, then depending on that your interest and the current trend during that time, you can opt any particular surgery or particular. That time, many new fellowships or newer subspecialties may come up. Accordingly, you can choose. Okay, so be flexible now. What happens is I made the same mistake during residency. Before residency only I had made up my mind that I want to be a cardiac surgeon. Okay, so what happened during my residency, I gave less importance for GI surgeries, laparoscopic surgeries and all. Okay, when laparoscopic surgeries was happening, I used to not go there only. Anyway, I'm a cardiac surgeon, why will I do laparoscopic and all? Hey, good. So okay, so that's not good actually. If you're flexible, then you will take interest in everything, you learn everything, so you'll know everything, and then you do cardiac or uro. But during residency, being present. Present is what? Enjoy, be versatile. Try to do all the surgeries, know all the surgeries. Who knows? In the future, it may help you, even being a neurosurgeon or cardiac surgeon, to make some decisions or to assist someone, to help someone in emergency. That may help you. So don't take anything for granted on day. Don't assume or presume things by yourself. You don't know. Still, what's your destiny? So give importance for everything. Observe keenly. Have interest in everything during residency. Okay, at the end of the residency, you can take up a decision what's future, what's going to be way ahead, whether fellowships, super specialty, or if you're confident enough that you can do anything, you can manage anything, then directly go start your clinical practice right away. Okay, so it doesn't really matter.
Yes, sir. And so, kind of one more very important question, which is also a very personal question to me, is about girls taking up surgery as a specialty, sir. Like, what are the challenges which are seen ahead? And there's also this question or talk of toxicity in the field for girls when we are entering the field. So what is your opinion on that?
Scalpel doesn't know the gender. What is that? Scalpel
the gender
doesn't know the gender. Okay, it's a female, so I can't be held by a female. I should be held by a male only. No, nothing. No such kind of bias at all. Okay, again, I told you, no. If you are good, if you're patient-centric, you are male, female, whatever you are, you'll get patients. And doing the surgery is left to you. If you're interested, you do. If you're not, leave it. Okay, so Success, again, it's a very personal this thing. Okay, it doesn't depend on any gender or caste or place where you are practicing, with the college from where you're done. No, only thing matters is you and you. Okay, understood? Otherwise, how the quacks would have survived? No degree, no nothing. How they're still surviving? How? What's making them so popular? And even in at 21st century, so many people are going to quacks. Why? Because this is good.
Yeah.
Their convincing way, their communication skills, which from a topper from the Harvard also will not have. That kind of communication skills, management skills, they will have possess. That's why without any degree, I don't encourage that, or I don't substantiating that. But what's really required in our field is that if you are good, if you're really taking care of your patients, definitely male or female. See, what as per my knowledge or my experience, females really do well in surgery. Females really do. Only thing is that they lack confidence, self-confidence. They're really hardworking. Okay, they're really hardworking, and there is a saying in surgery, surgeon should have eagle's eye, lion's heart, and fingers, ladies' fingers. Why? Because they're so meticulous. Even now, when I do surgery, final suturing, I give it to my sister. You know why? At the end, I do the inside everything, but final suturing, I give it to my scrub nurse. You know why? They do very well, because they're so, they have a lot more patience than us males. Okay, and they're very sophisticated and very meticulous work. Whatever they do, very meticulous. That's why they say in surgery you should have ladies' fingers, so soft and meticulous. So see, when the dictum itself like that, then why you think ladies are exempted from surgery? What's really required is you should get rid of that estrogen effect, confidence. Okay, you're lacking. Okay, yes, there will be that all this are not really true. That discrepancy will be there. No, in fact, ladies will have more advantages or preferences by the consultants. Okay, because you are sincere, more hardworking, not calm chores like usually boys usually do. Okay, so in everywhere, ladies or girls are preferred. Okay, so you will have upper. In fact, when I was doing class ಮಾಡ್ತಿದ್ದೆ, ನಾನು ಮಾಡ್ತೀನಿ 10 ನಿಮಿಷ ಮಾಡ್ತೀನಿ, ಒಂದು 10 ನಿಮಿಷ ಮಾಡ್ತೀನಿ, ಕ್ಲಾಸ್ ತಗೊಳ್ತಾ ಇದ್ದೇನೆ 10 ನಿಮಿಷ. So what I was okay, so what I was telling, Priya?
So you were telling about girls in surgery,
girl. Okay, so girls will do really well than boys. They have all the features to be the best surgeons. Only thing they lack is self-confidence, the self-belief. Yes. Okay, and in fact, many people are there who go for ladies doctors only. Lady doctors only they prefer. So, and I have in my own experience, when I was doing MS or MCH also, there were many girls who are doing cardiac surgery, neurosurgery. Nowadays, the trend has changed totally. Girls are taking up more of surgery, orthopedics, and boys are going into OBG. That's what happening nowadays, because there is no like earlier gender discrimination or bias or like that. Okay, so if you're really interested, you take up and you will definitely do well. That's for sure. Don't get I already told you, don't go by the trend. You be the trend setter.
Yes,
general trend is like that. In AIMS में कोई देता नहीं भाई, ऐसे बोलते हैं सिर्फ. No, all these are simply presumptions and someone else's experience that may not be true for you. You are different. You are not like him or her. You're totally different. If it's not worked out for him, doesn't mean that it should not work out for you. Am I right?
Yes, sir.
Because you're totally different. Okay, so there is nothing like that, girls or boys. Okay, only thing is that that notion is there in the society, because they think that why this I'll tell you why this general notion is there. They think that if any complications happen, males can handle that better than the ladies. They think like that. Okay, but you give the reassurance that I will not let any complications happen only. I'll do so meticulously and I'll do so nicely. I'll not let any males may do complication, then later they manage. That's different. But as a lady surgeon, I'll not let any complications to arise only because I'll take care, because they are more empathetic. Ladies are more empathetic. They communicate well with the patients and attenders. So in all those aspects, they'll do really well. I have seen very good lady surgeons, both in the teaching as well as in the clinical setup also. They do surgery really well, really well. Okay, so as a girl, you should be very much confident and enthusiastic to take up surgery and do better than others. Do better than others. Don't go with the trends. All this are not for you. Okay.
Yes, sir. So that was the last question out of all the doubts I had. Should we take up questions from the chat?
Yes, please. Yes, please. Yes.
So here there's a question: what were the challenges you faced while handling work in life? How did you manage? How was the work-life balance? What should be the attitude towards it?
Yeah, this is a common question. Work-life balance in any profession for that, and especially a bit difficult in our medical field. Okay, especially as a surgeon, anytime emergencies will be there. Anytime you have to go. Okay, you can't say I'm in this is off time, or okay, I'm not in duty now. You can't say all those things. Anytime you might have done a surgery in the morning, at the night 1 o'clock it starts bleeding, and you can't say I'm sleeping or it's not I'm not on duty. You can't say. You have to immediately wake up and go. If you're in some program also, you have to leave everything and go for that. You should be ready for that. So work-life balance again depends on your priorities. How you prioritize things. Okay. So don't be don't overlook something for something else, some gain. Okay. So you have to prioritize equally. Okay. So that's only initial phase of your residency or your life. You will face all these difficulties, but as you like grow up, or as you become more experienced and senior, all your physical works or extra works or becomes less and less, and more of you'll become more responsibilities come up. Okay, so you'll get a lot of time to manage everything, and you'll become matured enough also to how to manage things. Okay, so thing is that you should not give too much attention or too much time for anything. You should not be immersed in only one thing. You are posted in something is not the only thing. Definitely, you try to do the justice for that work, finish that off, leave that, and come back home and give your time. Don't mix up things. Professional life, don't bring what are the complication happened in the ward, that frustration you bring at home and discuss the same, or be upset over that same thing. Then your work-life balance will be lost, or else there will be harmony. Everyone understands what you are going through. Who are there at home, parents or the partners, whoever, they can understand what you are doing, how you are doing, how difficult it is. Everyone understands. Okay, but if you mix up things, okay, there some consultant scolded you, that the frustration you bring it to home and show it on your parents or the partners, then everything becomes complicated. You yourself become upset. Oh, what I'm doing, what I'm talking, why I'm doing like this. So that should not happen. You should not mix up your personal and professional life. If you keep it aside, what happened in hospital only. In my personal time, I should be talking well with my parents. When I'm at least 1 hour you are there at home, that's okay. In that time, don't be always looking at your mobile or your some social media. Instead, spend some 10-minute quality talk with your parents or whoever your relatives are there. Okay, so that's how you can manage both. It's not the time that matters, but the quality. You spend 10 minutes on. See, when I was in residency, I was a only PG during my. Just imagine. Okay, I was the only PG in my unit, and I had to do all the duties, 48 hours duties, 72 hours duties, not just one night duties. Weekly, I had 3 night duties to do, and rotational Saturday, Sunday duties. Everything I had to manage all alone, and I didn't had even 5 minutes time to think about my home also. But I had made sure from the day one of my MBBS, from when I was in Bangalore Medical College hostel, every day at 9 o'clock, I'll call my parents, and I'll talk for 2-3 minutes only. Even they will not be waiting for the entire day when I will call. 9 o'clock is a fixed time. Any day, even now, today also, my father will call at 9 o'clock sharp. He will wait till 9 o'clock. Then 9 o'clock, he will call me. That's our understanding. Okay, 9 o'clock is the calling time. 3 minutes only we'll talk. Not more than that. But I've made sure that I'll talk to my parents every day, at least for 3-4 minutes. That's how it should be. It's not the 1 hour if you talk, you are more loving, more caring son, or no, or else not, you are not giving priority. No, it's a quality. Even 1 minute you talk, how you talk, how nicely, genuinely you talk. That's what really matters. So have that connections wherever you go. You may do your Amritsar in your residency. You may go there. But nowadays, distance and all doesn't matter. From Amritsar to Bangalore, you can come in 3 hours. Even if you're in Hassan also, Hassan to Bangalore also takes 3 hours. And what's the Amritsar to Bangalore also, it will take 3 hours. So distance, language, all those things really doesn't matter at all. So you take wherever you're getting, go there, learn the best possible, and observe things, okay, and take the degree and come back. The real learning, real training happens with your patients on your own. Okay, so don't worry about all those things. So many people have already done; they are doing well. That means that you will also do much better than them, because you have better facilities, better resources, better guides, everything. So you should do much better than all of them. Clear? You're muted.
Yes, sir. Since one question here, Prajwal has asked, he secured 12K rank, and how much does the college how much does the college where you do the residency matter, particularly as a post-residency practitioner?
No, so far nobody has asked me.
Again or not?
See, I'm so many years now. No, none of the patients asked me so far. Okay, which college you did your residency, sir? Which college you did your MBBS, sir? No, none. Okay, so it's only matters maybe when the doctors or talks among themselves. Okay, when me and Priya talks where you did this thing, is a BMC. That pride will be there. That's it. Okay, nothing more than that. Nothing more than that. Only we understand. For patient, it's BMC or MMG or Kota or Guwahati. How does it matter? How do they know? Understood. And what you learn, they don't know. They don't know about your knowledge aspect or your experience. Nothing. What they know is how good you are with them, whether their patient is well or not. That's all really matters to them. So which college, how much rank you got, which college you got, where you did, really doesn't matter. Okay.
So also, does it, I mean, like while applying to institutions, I mean, taking a position as a faculty or while
nowhere it matters. If you have, if you're done from premier institutes, yeah, it may add up for your CV a bit. But if you're not done from a premier institute, doesn't mean that it lowers your CV. You understood?
Yes, sir.
Okay. If you're done means it's a bonus for you. But if you're not done means it's not a negative thing. Okay. Negative remark on you.
Yes. So the other questions on YouTube you've already covered, and okay, that's it, sir. Those were the important questions. Someone's asked about MRCS.
Okay, MRCS, good option. During residency only you can give part 1. Okay, during second year or third year, you can prepare well. But I would suggest as a personal this thing. If you're really having any plans of going to UK and practicing there, or going to plan for any other Commonwealth countries like Arab countries and practicing there, then only it is better to do. Okay, just for a degree, that too in India, for practicing in India, it's not at all required. Okay, not required, because one thing is cost factor. You have to, and if you pay, you'll get that. Okay, university degree, MRCS, and not a big thing. 1 lakh, 2.5 lakh. If you pay, you'll get it. And second thing is every year you have to pay some annual fee, some $50,000. So here it's not of much value. Okay, so if you're really going there, if you're going to Arab countries, then it carries a lot of value. If you're planning to practice abroad, then definitely do it during your second year, third year of residency, or immediately after your residency. Otherwise, not required. MRCS.
Okay. Yes, so that's pretty much it. That sums up the whole discussion. So it was very enlightening, and you've cleared all the doubts. Thank you very much, sir. Thank you very much for this session.
It's always a pleasure guiding my juniors. Whatever the problems I faced, okay, my juniors should not face. That's the only concern here. Otherwise, you would not be wasting so much of time discussing the same things again and again. I want to stress some highlight important points, so that they don't face the same difficulties whatever we face as seniors. If you face some new problems, then it's up to you. Okay, but whatever we face, same thing you are facing, then what for we seniors are there? Correct. As seniors, it's our duty to help you and guide you. So that this should continue. Next year, Priya will guide her junior. Okay, and this should continue like this. Only then this always mutual. Okay, mutual. Say Priya tomorrow she may become one super specialty in something, and I may take her help later. Okay, so please help me, Priya. I don't know this. Okay, So that's how it's always mutual. Now she learned something from me, and later I may have to learn a lot from her later. Who knows? 5 years down the line. So that's how it goes. That's how it goes. So take all the opportunities to help others. Okay, that indirectly helps you. Okay. So with that, I once again congratulate all of you who have taken up surgery or taking up surgery, and I wish all the success to our next time going to take up surgery. Okay. Any help, anytime, let us